Today, we're going to learn about the needs, the gaps, and what is next to develop mobility options for Missouri communities. You're going to learn about the benefits of mobility management, why accessible transportation options are vital. You're going to learn about coordinating council on access and mobility, or CCAM partners. And we need to talk about why the disability community must be at the table here, and what is the importance of mobility to those with disabilities. Our first speaker is my friend and colleague, Enjoli Dixon. She's a technical assistant specialist and project associate for the National Center for Mobility Management. But where we are so lucky is that Enjoli is the regional liaison, but she's based right here in Missouri. She knows what other states are doing, and she knows how to bring those solutions back to Missouri, her hometown. Enjoli has spent over 15 years in the US and abroad in the transportation industry in both public and private sector, as well as designer and as consultant. In the past, she worked at the National Aging and Disability Transportation Center, which is facilitated by Easter Seals, where she began her transportation career with University of Kansas. I think that makes her a Jayhawk and I'm a Tiger, but I'm going to let that go. She also served on, worked for MoDOT, a part of their multimodal transit team. She worked for the Office of External Civil Rights and has just worked on transit projects spanning from bike, pedestrian, rideshare, bus rapid transit, major light rail, ADA planning, and more. So you can see why we're so lucky to have her today. Enjoli also serves as the Chief Program Officer for TransitCon, and she has all this experience because of her rich education. She has an associate's degree in civil engineering technology, a bachelor's degree in agriculture, a master's in architecture and urban planning with an emphasis in transportation and transit. So of course, all that knowledge, she has to be an instructor and teach that to others and to us. She is on multiple committees and does stuff in her community with gardening and scouts, the Salvation Army. So let's welcome Enjoli for her knowledge, energy, and expertise and start our roadmap for robust.
First, as Stacey already told you all, I am the regional liaison, FTA regional liaison for regional offices 4 and 7. We are in Region 7, which includes Missouri and our peers, Iowa, Nebraska, and Kansas. For NCMM, we are one of the TA centers, and we have a consortium, which is with APTA and CTAA. We like to promote customer-centered mobility strategies and that advance good health, economic vitality, self-sufficiency, and community. Community is, I think, our overall kind of purpose why we are here today. But more importantly, also, we want to touch on is to promote cross-sector partnerships. And that is very, very important this year, as I'll touch on more in my presentation, talking about the Coordinating Council on Access and Mobility, which is the acronym is CCAM. Mobility management. What is it? Why is it? What is the role of mobility managers, especially as we're looking to innovate new types of mobility? Really, these two things are I want to say the two priorities that are mobility management. Understand available funding sources, and we saw that in the chat. People are looking for funding sources, and how can we use them? And that's where CCAM comes in and the federal fund rating. And we saw that someone also asked about that. These two, as Stacey said, are two separate presentations and trainings all on their own that we will be having some more information on that. And we have lots of publications and documents on that as well. So shoot me an email or contact me when I put that up in the end. I will definitely send you all that information. The other part, though, in order to make the first part happen is to develop networks and your relationships with a diverse group of partners and partners that are not your normal partners in the mobility field, okay? And that's then after you develop those partners is when we start working on the cost sharing and the cross partnership funding model. CCAM, real quick, it was an executive order that was established in 2004, and it was solely just to coordinate the efforts of federal agencies that fund transportation. So we know there are a lot of federal agencies that if you dig and dig and dig below the layers and you look at kind of their budgets and their different funding programs, there's usually that little tiny piece, and sometimes now larger pieces that will help fund transportation. And so CCAM, they want to focus on activities that improve availability, accessibility, and efficiency. And they target the following populations: individuals with disabilities, older adults, and individuals of low income. This is kind of the primary organization's chart of how it started, the agencies that helped to develop the CCAM process. And since then, the list has grown and more agencies have came on board. It started with 130 federal programs, and now it keeps growing. But initially, the 130 federal programs were the ones that were able to provide the funding for human service transportation. And like I said, that's a whole separate training or workshop, and I will be happy to send you that information to research further. Federal funding braid, just going to touch on that a little bit. There were sessions that were held to help develop the federal fund braiding guide. There is a guide on it. There's also a guide that we have on cost sharing and partnerships. And basically what it is that you're taking federal funds from one grant program to use it as a local match requirement for another federal program. And why this is important is because a lot of times you apply for a grant and then you look at the match and you're like, oh, I can't do it because I can't come up with a match. We know now, we hear in a lot of communities as we travel across the US, it's really, really hard to come up with a match. And so you can, for a lot of programs, use one pot of funds to match another pot of funds. And then you're able to help either implement, enhance, or either sustain an existing program. Now down to the meat of this, overcoming the barriers in transportation. For my presentation, I want to just kind of provide a high level overview, ask some questions, get your kind of brain thinking, and kind of, get kind of ideas kind of jogging in your brain. And then Ed is going to touch on kind of the meat of it in a specific area of Missouri to give you a better example. We want to look at how do we overcome the barriers that we look at in the state of Missouri and the transportation gaps. So we know first we need to identify the issues. MPTA did a study to identify transportation gaps with Lockmuir last year. We know there's been past studies that MoDOT has put out there. And with all of those studies and all of the different groups and even grassroots organizations that are identifying the gaps everywhere, we will then need to analyze those, dissect those, and then connect with those in the community, which are mobility managers, that are right there. They're the boots on the ground that know the exact barriers and where those gaps are is in and out, and able to tackle those issues. We want to access the community and the mobility options that are already out there. And then we want to advocate for more and more mobility and connectivity of the mobility. These pictures that I will be using in the slides are there on purpose because they make you think. What do we think about? And you can drop in the chat when you see that it says sidewalk closed. And we'll come back to those thoughts after I get done with the presentation. And then we have the guy with the box on his head, stepping outside the box. What exactly is stepping outside of the box across for the state of Missouri? We look at our peers and we see what they're doing. And we look at some of the public transportation that we have, that I'll touch on another slide a little bit later, in Missouri, and how some of them have encroached into our peer states and they've started to step out of the box. And then the question's always asked, why should we step out of the box? Well, we know in order for us to obtain more mobility options and better transportation, also to obtain more funding, especially for those that may be disabled and those that are aging in our population. And those are two big things for the state of Missouri. I want to quickly point out that if you did know, and you should probably already know, that the governor has tasked DHSS, and there's a whole lot of agencies, which is basically CCAM agencies, but on a state level coming together, and they are starting to develop the master plan on aging. Within that aging population, there is a large number in the population that are also disabled. And that is one of the priorities that is in that aging plan. And so we need to look at innovative ways to step out the box and look and see not only what we need, but what other people are doing, what our peers are doing, in order to make sure that we improve what we already have and that we become more innovative to make sure that we are reaching the needs of those people. How do we step out of our comfort zones and talk to each other? It's all about inviting everyone to the table. All the agencies may not come to the table. All the groups in your local community may not come to the table, and that's okay, but you keep inviting them, and you keep inviting them, and you keep inviting them. And then eventually that aha moment happens, they're gonna come to the table. And how do we do that? We have to get out there and talk to each other. We have to have those difficult conversations And we have to develop better partnerships. And those partnerships, I don't mean are just your normal partners that you always partner with, that you partner with for the last 10 years. So if you've always partnered with United Way, okay. If you've always partnered with your social service office, okay. But think about other partnerships that you may not have thought of. As you go and research the CCAM, think about, have you thought about partnering with USDA? You know, there's someone, you may not, they have transportation components in a lot of their grants. You know, that's another person, another partnership that is stepping outside the box and looking at how you can help people. You can help people a lot of ways with that partnership. Not only do they provide transportation that tackles a couple of issues, making sure that person stays healthy by they're getting access to food through food access and mobility, which makes sure they're healthy and they're able to get their doctor's appointments, and they're able to make sure they're not continually going to doctor's appointment for declining health. And so it all ties in. It's like a domino effect. So we don't want to panic or worry about it, but let's talk about it. Let's identify truly what's important. We know that we have gaps, and our main gaps here and our main issues in Missouri is infrastructure is a big one. Not only roads, sidewalks, but also technology issues. So internet, broadband is an issue. And so what we need to do is it's time to start taking action. So we know that we have the master plan on aging that's in development, but before that master plan on aging was tasked with DHSS, there was a Missouri Transportation Task Force that was developed. And I want to highlight that task force, which was developed around 2019, because I truly think that without that task force and those convening of so the first summit, I believe, had 100 people. Someone can correct me if I'm wrong. And then we know that COVID happened, and then more people start asking and say, let's get back on that horse and keep it going. Without that task force and the research done by those individuals and nonprofits and agencies that were involved, is when then we got the attention of the state, right? And then they looked at other issues that connect to mobility. And then that's when the aging master plan started to develop, and they thought, oh, we need something like that. So that task force took action, and that leads us to where we're going today. But without that, we look at universal mobility. We need to remember that it's not just, let's put a bus on the road and we can pick up someone at a stop. When you see this picture, what do you think about this picture? And Stacy, can you look and see what people have dropped in the chat? Because I truly want to see what the comments are on this picture. What do you think is happening in this picture here?
I'm not seeing anything yet. Let's give people a chance here.
Okay.
Christian said, our streets are exclusionary. And Lisa said, this is scary. Not safe. But Greta said, you go, Grandma. It is like a bike.
Okay. Okay. So this is really important. Universal mobility is a fairly new thing, but it's very, very important. A lot of times when people say universal mobility, you can't do that in a rural area. Okay, I see that comment. People just think, oh, okay, universal mobility, that means, we include mobility for everybody. That's a little bit different than inclusive mobility, but it does include, universal mobility needs to be inclusive. It truly just allows for equitable transportation for all. But I want to highlight that it starts at the design and the planning phase of it. So in this picture, pretty much, they developed these beautiful bike lanes, and you see in the distance there a bus stop and the pedestrian walkway and all the markings. But they forgot about, like someone said, Grandma over here, where is she going to go? Right? There's not proper space on these little tiny sidewalks. And you can even see where the students are stepping down there, of where she's going to be able to ride in order to get to the bus stop. And where is she going to wait? So universal mobility is including everything from the sidewalk, from the stop, the crosswalk, for everyone, for any type of device that anyone is using, whether it's a bike, scooter, motorized scooter, wheelchair, if I have a walker, if I'm in braces, and that's very, very important. What will most likely happen is that she may go and say, hey, there's nowhere for me to go. This is a dangerous situation. And they will bring her in as an afterthought. And that's not right. She needs to be at the table from the very beginning helping to plan.
Yeah, we've got some other good comments. That no one should be forced into the street to get around. Someone said, I believe it's Ed, I'm wondering if this person had to opt for the street because the sidewalk was not in good repair. And we can see kind of where the sidewalk's coming apart there. And we have another one that the combination of reckless or inattentive driving in areas with dysfunctional crosswalk lights and poor wide walks frequently intersect, haha, a point for a pun, in many parts of St. Louis County, and each year as a non-driver seem increasingly problematic.
Okay.
And
This
then
is
someone was worried, is grandma using proper flag signal for her scooter? I don't think that there's any flag on there at all.
right. I just want to say, and I'm almost done here, and I'm going to turn over Ed, is that when I was driving the other day at Jefferson City, Jeff City has a lot of hills, especially going down to the Boulevard and off Southwest Boulevard, all those areas. And I saw a lady going down as the big hill down towards the Boulevard. I think it's Southwest Boulevard, and it was really scary. That's a high traffic area with trucks, and even Jeff Tran goes down, and things like that. And she was just riding along in her scooter. And I automatically in my head was like, why is she riding around in her scooter in the street? There's not sidewalk down half of that hill. Could she not get a ride? There wasn't any type of service able to pick her up, And some prefer to ride their scooter like, I can get around, I don't want to wait for a bus. But it's very, very scary. So there are other resources that I can also send to you in CMM, and we partner with SUMC, the Shared Use Mobility Center. We have a whole learning module in universal mobility that is one of a kind. The only other one is the Metropolitan Planning Council in Chicago, who did one for the Chicago area. Ours is for nationwide, but both of those are great resources that I would like for if you all have time to look at and to pass on to your community leaders. This one, sidewalk closed. So that's getting to the comment there. I wonder if the sidewalk was not in good repair. And that ties into addressing the barriers, okay? Are we fully addressing the barriers in our communities for transportation? Are we navigating around the barriers, and are we trying to remove the barriers? So examples here, COVID, VA healthcare, mobile healthcare, virtual healthcare. I put these down here because COVID taught us a whole lot. And while COVID was so horrible, it really was an aha moment. It opened our eyes to a whole lot. I come from a military family, lots of veterans that are now, my grandpas that are 85 years old. My dad was a veteran, and unfortunately he's passed. But we know that a lot of people, especially due to COVID, or even before then and even now, especially if they're a veteran and they're disabled, and both of mine are disabled, it's really hard to get to VA if they don't have a ride, right? And even sometimes with the volunteer programs, there's no way to get there. They're starting to develop clinics in rural areas, but still, how are they going to get there even locally? And so I know that kind of as a solution, we're starting to see that. I'll use VA as an example. You may not be able to get to the closest VA hospital. I met a couple, it's a disabled veteran, and he had to drive all the way from past the lake area to get to Columbia. And for him to get to that one appointment for one issue was like 2.5 hours. And that's a long way. And then you have to wait in VA and do everything you need to do in testing for like probably 2 hours, and then have to drive back. And he had a very interesting story. We saw them at the VA appointment at the time, my dad, and we ran into him for lunch. And I was like, I want to, talk to you all during lunch and treat them to lunch. And I listened to their story. And I felt really, really bad because all the time that they have to travel, and there was really no other way to get there. And his wife was able to take them, but everyone doesn't have anyone to take them, right? Back and forth to the VA clinics. Now we know, like here locally in Jeff City, we have a VA clinic that takes care of some of the problems, but still it's way out on kind of the edge of town. And how do people get there? Still, there's no way to get there. So that was kind of a way for VA to, they're kind of addressing the issue. They kind of navigate around some of the barriers, which is transportation, because we know that DAV can't pick up everyone. They're short of volunteers and staff as well, but they're working on removing the barriers now and looking at how they can connect a little bit better with regular doctors' offices that are outside the VA district, or clinics, or even rolling out their mobile clinics. And we're working on a big project with them to try to remove the barriers. And so when we talk about addressing the barriers, We can't look at that as always an obstacle in the way. We need to look at a way to kind of navigate around them temporarily, same thing, provide mobility options, and then also look at how we can remove those barriers to make sure that we have full access to mobility to get wherever we need to go. And in order to do that, it takes partnerships. Partnerships, partnerships, partnerships. You see the shaking of the hands here. We have got to come to the table and we have to shake hands. If we don't have partnerships, we aren't able to maximize the services here, and we can't share funds. When we maximize our services and we share our funds, we make sure that we can sustain our systems. We have a ton of money flowing down. We don't know when that money is going to come again. And it's always been a requirement to partner when you receive federal funds. A lot of times, you know, when you fill out applications, who are you partnering with your community and things like that. And now it's truly, truly being enforced. And so we just need to do it. We have a CCAM partnerships guide that I can share with you. Very, very important. And it even gives you examples in what types of partnerships. We don't want you to reinvent the wheel, but right here in Missouri, we can have those same partnerships that our peers like Kansas, Iowa, and Nebraska have. Regional coordination. This is Kansas City. I use them as a model because I remember back in the day when I was a consultant with trans systems for Kansas City, all these were little bitty pieces of systems everywhere. And you had to try to get to the next one, to the next one. We didn't have scooters and bikes on stuff in between. You just had to figure it out. Now it's one coordinated system, and it even reaches all the way over to Kansas, past Olathe to Lawrence, Kansas now. And so wouldn't it be great in an ideal world, and fingers crossed, that we had a statewide system of some sort? And yes, we have Greyhound and we have Amtrak a little bit in certain ways, but wouldn't that be great? Regional and statewide coordination is something that we need, especially for those, if you are disabled, if you are aging. We get a lot of phone calls, even at the different TA centers, for those that are asking, I need to go to treatment. And it may be across the state. I need to go KU-Med, or I need to go to Barnes, or I need to go, somewhere down in Springfield. And there are a lot of states that have services or commuter routes or things like that through the public transit that allows for people to get there, do their treatments for a couple of days and come back. And that's so, so important, especially in rural states, because people are missing out on vital healthcare programs because they just can't access them. So mobility management activities, use role programs, we have the one-stop shop, travel training, voucher programs, volunteer, but we need to think outside the box. Healthcare mobility managers, okay? We know that West Community Action down in Nevada, Missouri, and New Growth, they're doing working on programs. They have mobility managers. Missouri Rural Health is working on healthcare mobility managers, try to connect with those partners that are outside the transportation industry. Looking at statewide mobility systems and also looking at mobility hubs in rural areas. And last, I'll kind of skim over these. These are just various examples of various examples of other states that we can pull what they have and they're applicable in Missouri. And so what do we do now? Where do we start? Who do we invite to the table, and how do we act and implement? And I'm going to turn that over to Ed to go ahead and present, because he will kind of go a little bit further in depth, and he certainly knows who to invite to the table, and he has done it. He's done a great job of it. And so if there's any questions, please drop them in the chat and I will answer those after he gets done. I do want to provide these resources for you. These are the Federal Transit Administration TA centers. We have NCMM, NADTC, National RTAP for Rural, Shared Use Mobility Center, and NCAT. And we also have a new center, the Transit Workforce Center, to help with those transportation needs of workforce, shortage of drivers, and things like that. Once you remember that there's no I in team, we all need to come to the table and do it together. And then here's my contact information.
Excellent. And yes, Leslie asked about those resources being emailed out to attendees, and that will be sent along with the recording. We have quite a few questions in the chat while Enjoli is getting Ed added as a host there.
Just a second.
So Enjoli, may I read those to you and, or did you want to wait until Ed finishes?
I can wait. I want to make sure that Ed has his time.
Okay, great.
I'm not seeing his name as his name. Is he coming up as someone else?
Yes, it is director at DD.
There he is. Okay.
And there might be more than one, so only Ed be the one to talk.
Okay. He should be able to share his screen because mine is, I took my screen off. I want to let everyone know if we don't get to all your questions, we will certainly take this thread and answer the questions and send those out there to everyone too.
Okay, can everybody see me?
Yes, we can.
Oh, and everybody can hear me too. Wonderful. Oh, my glasses are crooked. I should have just, anyway. We will go ahead and welcome everybody, and I appreciate you all attending this. Great information, Enjoli, and I'm just going to continue some of the information that you provided in your presentation. I'm going to kind of narrow it down to what we did here in Central Missouri, here in Camden County and the Lake area. I want to share, hopefully I can share my presentation. Can everybody see my presentation?
Not yet.
Try sharing again.
But we're really excited to see it because I saw it in advance and I know it's great.
I am trying to get that share screen. Okay, there we go. Hallelujah, there it is.
There we go.
There we go. I'm going to start this from the beginning. Transportation, how do we get there? Everybody can see that.
Yes, sir.
Awesome. We'll get going here. And back in 2015, Camden County Senate Bill 40 board, we're doing surveys with our clients. We serve individuals with developmental disabilities, and we were doing surveys with our clients to determine what the interest was in competitive integrated employment. That's where the focus began. We distributed these employment surveys to our clients and completed an analysis in 2016. What we started to quickly see is that folks wanted to work in the community, but they did not have transportation, or there was a barrier to that transportation, or they didn't have reliable transportation. So having a significant barrier to competitive employment was the transportation, but you know, that also leads to the issues that, well, how are they accessing their community? If they can't get to a job, how are they accessing their community for other reasons? Shopping, recreation, healthcare. There's all kinds of things that we need transportation for. A lot of people take for granted that, you know, folks have cars and sometimes in some households, multiple vehicles. So it was kind of an out of mind, out of sight thing until we started taking a closer look at it at the community abroad. What we did find out is that of the CCDDR working age clients, 71% of those individuals who were interested, who are working age and were interested in getting a job in the community could not drive, or they were not capable of driving. That's a huge number. And today that number still rings true. We just recently completed another survey last year, and we found out that transportation is still a significant barrier, even after all the efforts that we've done over the past 6 or 7 years. What we tried to do was create a community partnership. We created what was called the Lake Area Transportation Task Force. This stakeholder collaboration began in April of 2016. We reached out to other organizations. We had a long laundry list of organizations that came to the table. We had our first meeting in April of 2016, and I would imagine there was roughly around 50 agencies that attended, or representatives from 50 agencies that attended. That gives you the perception of how big the issue was. It was an issue that everybody knew was a problem, but not a lot of people were talking to each other about it. Henceforth, the silos that were created as a result of some of the efforts in the past. We did a lot of research and analysis. We used available data and formulated new raw data to determine the need, which began with a focus, of course, on employment. This all led to the formation of a new not-for-profit at the lake area called the Lake of the Ozarks Transportation Council. I currently serve as the chairperson on that board of directors, and we are always looking to improve the systems available in the lake area. We administered a general population or a community-wide survey that included all individuals in the communities, and we were very specific in our questioning. We asked individual users, individuals in the community that would use public transit services or transportation services, and we also asked businesses what their barriers were that were related to transportation and transit services. It was interesting, some of the results.
Ed, can you change your slides?
Yes, I did. I thought, am I frozen? It should say what the task force discovered general population survey data.
It has not changed. You might have to hit play for me and then slide over.
What screen are you seeing?
The first screen. How do we get there?
Still not advancing?
No. Would you like for me to share in advance for you?
Sure.
Okay.
I'm sorry if I did not do something correctly.
Okay. Please let me know which slide you are on.
Looks like we had to take away Ed's driver's license and now Enjoli's driving it.
Speaking of transportation. Okay. If you go back one screen,
there we go.
there we go. There's where we're at. Okay, what we discovered in our local surveys, and by the way, we received over 1,000 surveys in the local area, which we thought was pretty significant. We incorporated a lot of not-for-profit partnerships that administered the surveys. Out of this data, we were only able to keep about 600 of them because over 400 of them, we tried to keep the surveys exact, and one of the not-for-profits took the liberty of changing some of the questions. They included the original, but they changed and added a couple of little small caveats in some of the questions. Therefore, we did not utilize them in the final results, although those additional 400 survey responses were in line with everything we see in these data points. I tried to keep it to where we were as scientific as possible, even though it wasn't a scientific survey. 42% of the employees have transportation barriers. This was from the local employers. 69% said employees would benefit from public transportation. 82% of those employees had an annual income of less than $25,000. So you can kind of see a pattern here, because a lot of the folks that need public transit services or transportation services are generally low income individuals. 53% were willing to have a transportation stop at their facility, and 39% of those organizations lose up to 5 employees annually due to a lack of transportation. Well, what can you derive from this data? I think the most specific derivative from this data that I was able to ascertain is that we might have a potential local match funding source, because if you talk to businesses and organizations, and if there's organizations on this webinar, then you'll understand how expensive are turnkey costs. How expensive is it to train an employee and then keep them for a while and then lose them, and they just have to hire over and over again? It's very expensive. So, we felt like we had some potential partners in the community that we could utilize in what could become rated funding sources. Can you move to the next slide? Out of this local task force came the creation of the Tri-County Transit System. And we partnered with Oats Incorporated, which managed and operated the Tri-County Transit Service. Oates is the recognized public transit service provider for our area. We're rural, and they are the only public transit provider in the area, as they are in a lot of counties in Missouri. And Oates has been absolutely fantastic to work with. 50% of the total costs for the route service and any services that we were trying to implement were secured by Oates through the FTA and MoDOT, and the other 50% was funded through our Camden County Senate Bill 40 Board, CCDDR. And what we were able to do is kind of break down an internal silo. You know, you have the external silos between agencies, but you also have the internal silos within some agencies, which means to say that, well, we can only spend our money specifically on services that help individuals that we specifically serve. Well, I proposed an idea to our board that said, wait a minute here. Community inclusion and community integration has always been at the forefront of some of our missions. So why is it that we have to only spend dollars directly related to an individual versus trying to spend dollars directly related to community inclusion? In essence, what I was trying to tell them, and they agreed with, is that even if you spend funds that were earmarked for individuals with developmental disabilities into a community program, and it benefits those individuals as a whole, even if it benefits individuals you don't serve, it's still beneficial, and it still serves the end purpose to your mission and to your specific positive outcomes. So we had to redesign or rethink the way we were designing new systems, and it was very successful. And I will note, we felt absolutely no resistance in the community at large on doing this. Everybody was very supportive. Local decision makers, businesses, public members, everybody was supportive of this. This service operated 7 days a week. The service hours were from Monday through Friday, 6:30 a.m. to 8:30 p.m. and 9 a.m. to 3 p.m. on Saturday or Sunday. And at that time, it was the only service, rural service at least in Missouri, that ran 7 days a week. It was inexpensive for riders. We wanted to make sure it was inexpensive for riders. The fares were only $1 per trip, which is very affordable. And we felt like that, you know, people could afford to do that. And in the surveys, people that were actually surveyed that would utilize public transit services were willing to pay up to $5 or more for a trip, because it was that important for them to be able to get access to their community. The route was deviated for easier access. There were many public or specifically public designated pickup and drop off locations. But it also, if you called in and wanted a ride and you were within, I believe it was 1.5 mile deviation. Yes, 1.5 mile deviation to accommodate individuals with disabilities and seniors. So they would go to someone's home. Now, this route was between Osage Beach and Camdenton, the two largest townships in Camden County, the main centers of population within the county. And a lot of the folks that we served, and I'm sure a lot of the seniors that were served, lived in that corridor where that route was located, which was Highway 54 in various locations in both townships. Next slide. This was the impact. In 2015 to 2016, we had not yet struck an agreement with Oates to provide services with our funding. They had 12,467 rides for that fiscal year for Oates, which was July 1st to June 30th. By 2018 to 2019, this was July 1st, 2018 to June 30th of 2019, they had recorded 33,635 rides. That's almost 3 times what it was 2015 to 2016. And the number one reason people were using the service was to get back and forth to work. Now, that is significant because it did accomplish what we set out to do, because at the time, I believe there was 11 individuals who were not working in the community that we served, actually got jobs in the community and could continue working because they had transportation to and from work, which was the original focus. But it also opened up the doors for individuals who just wanted to go shopping or needed a ride for recreational purposes. They could actually get on the public transit service and get from point A to point B. And the uniqueness of this is we broke down our internal silo. We dispelled the myth that you can only use the monies that you collect for a certain purpose for an individual specifically. We used it for individuals as a whole. If the service is not available, then individuals will not have access to that service. If it's not available to the general public, how can it be made available to everyone, and how can it be made available to the individuals we served? We opened up the door to the service being available to everyone. Next slide, please. Funding is always an issue. In Enjoli brought up, and Stacy did as well, the fact that in 2019, I believe it was August of 2019, we had the Missouri Transportation Summit in Columbia, and we had an amazing turnout. And, you know, I think everybody in that room that came to that first meeting in August of 2019 understood that transportation was an issue and had been an issue for many years. And everybody that came to that meeting was very motivated to identify the issue and bring it to the public's forefront and make it an urgent issue to be addressing. And I think we successfully did that, because in October of 2019, we created the Missouri Transportation Task Force with the help of the MODD Council. And at the time it was Chaz Nicholas, and now Stacy is helping us lead that cause. With the MODD Council. Enjoli joined us just in the last couple of years and really has been an absolute invaluable resource with some of the tools and resources that the National Centers for Mobility Management and East Hills can present, because we're not trying to recreate the wheel here. We are trying to address the same issues that other states and other areas of the country are facing as well. This is a nationwide issue. We created the Lake of the Ozarks transportation system back in 2015, 2016, started it in 2017. But in early 2020, Tri-County Transit suspended services temporarily due to the COVID-19 pandemic. They basically shut down for a few months. Tri-County Transit ridership began to gradually increase back to its previous levels before the pandemic actually officially ended, when they created the service or started the service again. But it never did fully get to the levels of ridership that it did prior to the pandemic. There are many reasons we can go into for that. COVID anxieties, people, a lot of the folks that were employed were no longer employed because a lot of things were changing. Unfortunately, operational costs significantly increased from 2022 because of COVID and the inflation that happened during that time frame. So funding from CCDR could not continue because we were now in direct competition with programs that we had been funding for many years that were just as critical and needed by the individuals we served directly. These were legacy programs where the cost to continue services was starting to rise in an astronomical level, in some cases as much as 20 to 40%. Oats costs significantly rise as well. So the cost to continue was no longer affordable for us. And the reason why we'd started it in the first place, those folks that were receiving waivers and utilizing waivers for door-to-door services, we were paying a portion of that. And by starting the public transit service, the Tri-County Transit, and funding that 50% local match, we were actually saving money each year. We were saving the state and the SB 40 tax fund. We were saving money through those mechanisms, but we were also saving overall through the federal match. Because in the Medicaid world, 65% is paid by the federal government, 35% is paid by the state or some local match entity. Whereas with the FTA funding, it was 50-50. Believe it or not, we were still saving the federal government thousands of dollars with the 50-50 versus the 65-35. So understanding that public transit as a first option is literally the most inexpensive option if you looked at it at that time. Attempts to secure additional local match to continue Tri-County services was unsuccessful. I will note there was one program that we did start in 2018, I believe it was, and that was the Bagnell Dam Strip Express. The Bagnell Dam Strip Express was not necessarily directly related to what we were trying to do at CCDDR. However, Lake of the Ozarks Transportation Council had worked with various different city officials, including the alderman and mayor of Lake Ozark, because they had an issue in the Bagnell Dam Strip. They had basically 123 parking spaces and a lot of businesses. Well, employees needed to get to work as well. Well, for those employees that drove, they were taking up all the parking spaces, which actually meant that there weren't very many parking spaces for patrons. So there was a huge issue, and it was costing a lot of money so that they can come up with alternative parking areas to be able to accommodate the patrons. In doing so, we created the Bagnell Dam Strip Express, which 100% of the 50% local match was funded by local private businesses. It was successful to the point where the mayor at the time boasted that, tax revenue increases because he thought, you couldn't prove it, but he said it's amazing that it's quite a coincidence that the year you start this service down on the Bagnell Dam Strip Express, that tax revenues, sales and use tax revenues increased between 8 and 9%. And this was still during the pandemic. So we felt like there was a direct impact on the local economy by being able to utilize various different funding sources. Now, the interesting thing about the Bagnell Dam Strip Express is it tied into the Tri-County Transit System. There was a drop-off and pickup location for each service so that patrons or employees who wanted to get to work could actually be dropped off at a location outside of Lake Ozark and be brought down through the Bagnell Dam Strip Express. So it was symbiotic, and we were able to successfully continue that program until I think it was 2021, when a lot of the businesses were struggling to make ends meet because of the pandemic. Therefore, they were not able to afford to contribute to that service anymore. CCDDR could no longer support the funding for the Tri-County Transit beginning in 2023. Effective 1/1/2023 this year, we were unable to continue funding the local match. However, Oates, couple of months ago, was still running that service, even though it was very limited. So I want to give a special shout out to OST because they realized the importance of the Tri-County Transit Service and the new approach that we were trying to take to being able to utilize public transit services to serve multiple populations and continue that idea moving forward with very limited funding. Next slide. The new focus in Camden County and the Lake area. And this is a derivative of what's been happening with the Missouri Transportation Task Force. Mobility management, mobility coordination, whatever nomenclature you give it, it is integral to the success of any transportation system or systems in any county or any locale. Because if you look at it from an outside looking in perspective, it just simply makes sense. We have so many different funding streams available. A lot of people do not realize how much funding actually flows through the state agencies, let alone what could be available at the local level to be able to fund transportation services. I know originally when we first started the Missouri Transportation Task Force, we were trying to ascertain how much was actually spent on transportation services through the Department of Health and Senior Services, through the Department of Social Services, for the Division of Developmental Disabilities, Department of Mental Health as a whole, including behavioral health, MoDOT. All of those organizations have budgets for transportation services. However, we really couldn't get concrete solidified numbers to be able to do a comparison to really know how much we were spending. And then on top of that, we had a lot of successful programs that were being administered in specific localized areas that nobody was talking about. And we wanted to tap into that. And mobility coordination, or mobility management, whichever you want to call it, is a way that you can. Here in Camden County, CCDDR has now shifted its focus on establishing a mobility coordination program. 4 CCDDR employees will become certified mobility managers. We will seek funding sources to start and sustain a mobility coordination program, establish a volunteer driver program, establish a robust network of transit options and mobility coordination partnerships. It's all about partnerships because, as I've said repeatedly in just about any new system or any system design process, 100 people given $1 is a lot more efficient and a lot more affordable than one person given $100. We are trying to establish this mobility coordination system through CCDDR. I've been out and about educating the local decision makers and local leaders here at the lake area to establish the fact that you may not see it, but it is a problem. Transportation is a problem. And, you know, just like Branson, who would have thought one of the biggest tourist centers of the state, who drives a lot of the economy and some of the revenues coming into the state, would lack transit services or transportation services available to every individual who may be visiting or who actually live here. So we're going to collect some raw data along the way. And we are currently working on additional surveys specifically related to transportation that we can administer not only to the individuals we serve, but in the community, because now is the time to do it. I'm actually now, for the first time, this will be the third 5-year strategic plan I've been associated with, or at least familiar with, through the Council of Local Governments here. And I've finally been invited to be a person, a part of the steering committee for the 5-year Human Transportation Services Plan. If you're not aware of what that is, every Council of Local Government, or if you will, regional planning commissions, I think is the more common term. Regional planning commissions are required to develop a 5-year strategic plan. And this year just happens to be the year that we're going to be doing it. So being able to put that into perspective and completing that strategic plan, because that also drives some of the funding that comes into the state of Missouri and how MoDOT can allocate it. I won't go too much into detail, but I'll be glad to talk with anybody after this if you want to know more information on how to get involved in that process. If we can establish a mobility coordination program, CCDDR wouldn't necessarily be controlling it or the center of it. We would be part of it, because if we create a mobility coordination program, next slide, please. This is what it will look like. Instead of transit or transportation services, a singular entity being at the center of this, mobility coordination needs to be at the center of this. Because I can go to my neighboring agency who may serve a different population than I serve, who are working on the same barriers and trying to overcome the same transportation barriers, and we can share information. We can share mobility coordinators. We can share resources. And I'm almost 100% certain that there are going to be new and unknown resources that are brought to our attention on a daily basis. And locally here, we're gaining quite a bit of traction with this because it just makes sense. And I think if we look at this from a broader perspective in the state of Missouri, we could probably implement something like this statewide. Each area or each locale has different characteristics about it, but we all have the same issue. The solution may be a little bit different as far as the path to getting to it, but we all have the same desired solution. We want to be able to serve as many people as we can, to be able to utilize transportation services to get individuals who would otherwise not be able to access their community, to be able to access their communities and live more fulfilling lives. Mobility coordination, in my opinion, is the answer to that, or mobility management, whatever you wish to call it. And a lot of people don't realize that, you know, one of the unique aspects of transit funding or public transportation funding or other transportation service funding is, in the public transit world, you can actually utilize federally gained dollars to leverage more federal dollars. In other words, if you are trying to establish a mobility coordination program, you are eligible to be able to apply for the MoDOT 5307, 5310, and I think 5311. Those three programs are the most predominant. And there is funding for mobility management. That is under the 80-20, 80% state share, or in this case, federal share, and 20% local match. You can utilize that to start a mobility coordination program, the best I understand it. And again, I'm a novice at this. I know a heck of a lot more than I did back in 2015 when I first started, but there's just so much information out there to learn still. And there are people that are a part of this webinar presentation that could probably help and coordinate with others to be able to help start this, or start this themselves. Because mobility coordination doesn't always just mean one organization does it. Mobility coordination is multiple organizations working together to establish a system that works. From that perspective, you can use unique braided funding. You can use funding that you may receive from an SB 40 tax account, as we do. We use our SB 40 funds to fund local match in a lot of the public transit services that we've funded in the past, and we hope to do so again in the future. But there's senior services fund boards. A lot of counties have the senior tax boards. Although I've been told they're called now senior services fund boards. Don't want to get that wrong. But there are also local organizations that give out grants to help with meeting the needs of individuals who would otherwise not be able to get services, whether that be medical services or other services. For example, we were able to start our mobility coordination program through a grant that was awarded originally through the CDC to UMKC. As a preventative wellness program, so that we can be able to access medical needs in the community, and people can access preventative care measures in the community which we serve. So there are ways to be able to find funding. It doesn't mean there's one big pot of money at the end of the day that you're going to have to be able to tap into to be able to get this. There are multiple pots of money. We just have to be creative, and I'm not going to lie to you, it's a lot of work. But I think one of the things that I've always, told everybody that works with me on these types of programs, it's a lot of work now, but I guarantee you it's going to be a lot less work in the future if we can get this going. Next slide, please. Are there any questions from anybody? And I know that Enjoli said that she's also wanting to answer questions at this time based on her presentation, but I'm more than willing to the best of my ability, answer any questions. I may not know the answer, but I can certainly try to find out the answer and get back with you.
Well, Ed, you already have a request that someone is asking for you to present this at MOAPSI conference.
Oh,
so
really?
It sounds like you have a date for that for next year at least. And there was also a question, where will you be recruiting volunteer drivers?
I've already reached out to local not-for-profits here. What we've tried to do is we've established a collaboration with New Growth Transit. I don't know if you're familiar with them. They are out of the Western Central Missouri Community Action Agency. They already have a volunteer driver network in, I think it's 8 counties in that area. We've asked them to add our county. And they have had multiple requests. I think in this year's budget request through HB 11, they added, I think, 4 total counties because their program has been so successful. It is truly a mobility coordination program where they are reaching out to different sources in the community, including volunteers, to be able to provide those services. Now, one of the challenges that they've had is the being able to offer accessible transportation. They've got plenty of volunteers, but they don't have plenty of volunteers with accessible vehicles. And they are actually, as I understand it, they've actually overcome that hurdle, and they believe they have a plan of action. But what I've done in an effort to prepare for that program coming to our area is to reach out to the local not-for-profits and say, look, we're going to try to bring this to our area. Are you willing to jump on board and be a partner in this program? Undeniably and unquestionably and immediately they say yes. Give you an example of one of the first organizations that I approached about this. They're called the Local Area Needs Initiative. We affectionately call them Lanai. It is a model, by the way, that can be started. This not-for-profit can be started everywhere in the state. It's just a board of directors that leads a group of like-minded individuals to meet the needs of individuals in the community. And they had a $103,000 budget last year. Out of that budget, almost $42,500 of that $103,000 was used on transportation services. Transportation last year and the year before surpassed their spending levels on needs related to certain categories. It surpassed housing. Housing used to be the number one reason or number one funding effort that they involved themselves with. Now it's transportation. That tells you how this has evolved over the past 2 to 3 years. And I think one of the most important critical factors in knowing is you got to educate leaders, you got to educate the state leaders, you got to educate your local leaders, because it's out of mind, out of sight. And you got to bring it to their attention. Sorry, I didn't mean that make that so long, but yes, we are reaching out to local not-for-profits who have volunteers. And the neat thing about the New Growth Transit program is they actually train these individuals to become volunteer transportation providers, and they are paid based on the federal IRS mileage rate, which doesn't require income. You don't have to report that as income. That's just a reimbursement for the costs.
Thank you, Ed, for highlighting New Growth. They are making moves all across the state, which is really, really great. I'm trying to go back with Stacy and we can address a lot of the questions here.
Just to throw this out, there are other programs like that in the state as well. That's not the only one.
We do want to let everyone know there will be a recording of this presentation on the site. So you will be able to access this information. And I'm looking through for more questions. If you have any questions, please continue to drop. Oh, I'm not sure if this question was answered. Why can CCDDR no longer support funding the transit, Tri-County Transit?
Yeah, the cost to provide services, not only through the transit services, but through all of our other legacy programs, significantly increased. And without Senate Bill 40 funding for those programs, they could no longer continue. For example, we fund a lot of children's service programs in Camden County, and their costs went through the roof. I think everybody's aware that child care, I don't like calling them daycare or just, child care anymore. I call them child care support services, because when I grew up, daycare was pretty easy. You drop your kids off somewhere and somebody watched them all day and then they got to come home. That's not the same nowadays. There's been a child care facilities and child care support agencies have suffered greatly through COVID. I know several entities have closed down because they just could not keep up with the costs. So without our funding, they would no longer be able to sustain the support services they provide for individuals we serve, kiddos less than the age of 12 years old. So we had to commit to that, and we also had to commit to some other legacy programs that were critical, and the needs of those individuals have increased over the past 3 or 4 years, and they've increased their participation in those programs. So we had to make a tough decision, and unfortunately, we felt like we could do other ways of trying to be able to sustain. Again, sustainability is critical. One-time funding doesn't help to sustain a transit program. It has to be ongoing. And if you can't get the commitments from other partners in the community, then you're not going to be able to sustain.
Okay, I know that we are over the time limit, so I appreciate those hanging in. I know we have a lot of information. People are very much interested. We will take the 10 more minutes and go till 4:30 and end during that time. I do want to go over the list, and thank you, Stacey, for consolidating all of them. We have here rural public transportation. We'd like to hear about possible rideshare ideas. We do know that across the state, and Ed can also attest to this, that there are various organizations working on rideshare options. We know that Enterprise was working with MoDOT initially for various rideshare programs, especially for workforce. But we do know that New Growth has partnered with Enterprise. We will be bringing Enterprise to partner and talk about some other opportunities as I met with them at the Shared Use Mobility Summit to kind of look at various spots where the gaps are in the state of Missouri. So please stay tuned for that. We've also visited looking at other mobility options like zip cars and things like that, which you don't normally see in rural areas, but making sure that those different options are accessible for those who are disabled, and that they can have that independence, also be able to participate in those various rideshare programs. It looks like we tackled at the short staffed. We know that a lot of people are short staffed when it comes to drivers. mechanics and such, but we do have the Transit Workforce Center as a resource, which is one of the federal TA centers, and there are various models and programs, apprenticeships and things. I know the governor's had an agenda for across the board about various apprenticeships programs, and maybe that is something that we need to look at in the state of Missouri as far as looking at staffing issues with different agencies, not only the large transit agencies, but the smaller ones. And so we can have that as a reference. Let's see what else is on here. Funding issues. There's a wealth of information. Really, the funding, as Ed and I both touched on, is that it's a lot of digging and finding that information. But I will tell you that if you go and you're able to look at the FTA CCAMP site, that also links to our site, and I will go ahead and put that link in below. That it will give you various information on who the partnerships are and what the funding sources are, and so that you can start there and you do not have to reinvent the wheel. So that kind of gives you a jump start on how to go about those various funding resources. And Ed, please feel free to interrupt if you see any other ones that I may skip.
Well, I think that, and we've got an email with all the questions. Thank you, Stacy. So that we might be able to answer some of these between Enjoli and myself, and maybe reach out to others to see if they have answers to some of these questions, and be able to maybe post that somehow.
That'd be good, Stacy. We can do that
because they're great questions.
Sure can. It'll all be part of the little package with the bow that has the recording, the links that you're sharing, and the PowerPoint presentations, some poll questions, and we'll include the answers to all these great questions you all have.
And these are great. And I know I'll address one of the comments in the chat. Was HealthTran very similar to New Growth? Absolutely. HealthTran, they actually, I think, believe now have a mobility management course that you can take that you can get CEUs for. Again, you see the direction we're going with a lot of this. We have to be able to break down our silos and reach across and make sure that we are tapping all the resources we possibly can. Funding is always the biggest issue. It isn't the need. We know it's there. It isn't the demand. The demand is there. It's the funding. You know, a lot of what happened with transportation and the awareness that's going on with the need for more is what happened. I think it was about 2 years ago when, unfortunately, for the northeast corner of the state around St. Louis area, where Oates was no longer able to provide transportation for contracted services through, I believe it was the Department of Mental Health, and it was causing a huge concern for those in that area. And that kind of brought it to the forefront when it came to the Department of Mental Health, which is basically for individuals with developmental disabilities, which is the industry I work in directly. That's my day job. But transportation as a whole throughout the general communities and the public, it's a need. It's not just with any specific population, whether it be someone with disabilities, veterans, or seniors. It is everyone. It is a huge need. And I think that, you know, again, going back with the philosophy of, if you're contributing to a system that helps everyone, including the specific population that you're serving, why not invest in it? Because the payback is huge, and it is truly community inclusive. So I just end with that.
I want to end with someone asked, how do we find our mobility managers? Traditionally, mobility managers, people think they're just in transit agencies, and that's not the case. I do want to point out we are working to kind of have a database and a way that you can find your community manager, your mobility manager in Missouri. Unfortunately, Missouri was one of the only states out of this region that did not have a mobility manager network. And so that is a goal to have established by 2024. And luckily, Missouri Rural Health kicked that off, and they started with their mobility management initiative, and they're having more rural mobility managers. So we're very grateful to them. And then New Growth has enhanced that, and they've added mobility managers. So, but we know that funding is you have to support those managers, and they do a huge job of coordinating across the state. So if you want to find your mobility managers, you can certainly contact us at the National Center of Mobility Management, and we pretty much have that listing, and we will put you in contact with those in Missouri, or if you're even on the border states and have to be transported or catch various mobility options across bordering states as well, to contact those mobility managers, because there are a lot of dual state mobility managers as well.
I want to throw in that the National Centers for Mobility Management, NCMM, is one of the most invaluable resources. I look at it at a daily basis. I have found so much information just on that one site, and it's given me so much insight on what we need to do here locally and statewide. And the resources, that the links that are attached to that one website are just invaluable. Again, I can't stress enough how important that's been in our development process here locally at Camden County, but also through the MOTTF, the Missouri Transportation Task Force, and other endeavors. And I would love to talk more about it. I know we're about out of time, but I will say this: if anybody would like for me to address an audience at your location, feel free to reach out to me. My contact information is out there. I don't know of anybody that doesn't have it, because I've been getting emails and calls constantly about transportation. I also do a little bit of coordination with the housing projects. Transportation and housing are directly related as well.
And I'll provide my contact as well. And I am dropping in the chat some resources we have. There is a webinar coming up that I think we can certainly learn from. They are not in our region, but they tackle the same issues. It is Ohio DOT collaboration with state human service agencies. I saw their presentation at the Community Transit Association of America conference, and it was excellent. And they have some great resources that we can use of how they're doing it. So I dropped that in there. I think we can also post that to the site, and people can register and get a feel for what they're doing, which is something I think very similar that Missouri is trying to do. Anything else, Stacey? I'll let you close it out.
Sure. I did just add to the chat, just to the host. I don't know if Enjoli, you can share that with everyone, but Paraquad is meeting with the drivers union tomorrow, and they are convening a call a ride users every Thursday night at 6 p.m. So if you want to be invited, contact Jeanette Mott Oxford at Paraquad. And again, you all are going to get the slides, the recording, a list of resources, contact information for Ed and Enjoli, and just please share. It'll be great to get the word out. We really appreciate your time. Sorry for the tech difficulties at the beginning, but we got it figured out, and appreciate you all staying with us.
Can we mention just real quickly about our summit in October?
Yes, October 11th will be the second annual virtual transportation summit. And we had a really robust agenda last year. It is free, open to everyone, and you all will be getting some registration information for that soon as well.
Thank you.
Thank you. Have a great night.
Thank you so much, everybody, for attending. Sorry for the technical glitches.
Oh, and I'm sorry, the meeting with the drivers union is not a public meeting, and it's Friday, but the Thursday organizing meetings are what are open to concerned residents. I apologize if I said that wrong. But contact Paraquad for so many things. Paraquad is wonderful. So thank you all. Have a great night.
Thank you. Have a great
you.